After heart surgery, typically you'll recover in the intensive care unit. Afterwards, recovery on the floor can be anywhere between 5 to 7 days, depending upon how quickly your body is able to recover from the procedure, and you're able to do things like walking and eating and deep breathing, which are important for everyday activity, which we take for granted before surgery.
Our surgical team is really hands-on here at Boston Children's in our program. You'll see whoever your surgeon was at least once a day, and we work closely with the ICU doctors and the cardiologists to make sure that during the ICU portion of the stay, we have your pain well controlled, that we're moving you towards getting the breathing tube out as soon as possible, that we're keeping you comfortable so that you can take deep breaths so that your lungs stay open and you don't develop pneumonia. We think it's really important for patients to get out of bed. We have you first sit in a chair, oftentimes as early as the night of your operation. We really try our best to get you walking down the halls, starting that pathway to rehabilitation, again, as early as possible. And in terms of other things that we work on during that period, you'll have a couple of tubes in the chest that drain any excess fluid or blood that might want to accumulate there so that it doesn't compress the lungs or compress the heart. We usually have some temporary pacing wires as well that we use to control the heart rate if necessary, and those all usually come out within the first few days after surgery. For simpler lesions that require simpler operations, we think that most folks can get out of the hospital in somewhere between the 4 to 6 day range after surgery. Those on the more complex end of the spectrum sometimes require a few weeks in the hospital, but our philosophy in general is that keep you here as long as you need to stay, but as soon as you're ready and have met sort of all the criteria that you need to be discharged home safely, we don't force you to stay a minute longer than you absolutely need to. We find that the vast majority of patients are experiencing very minimal pain and discomfort. Our goal is always to get you comfortable enough so that you can take deep breaths and keep those lungs open. And not only does that prevent pneumonia and lung collapse, but obviously it's good because you feel better. We have instituted the ERAS program, that's Enhanced Recovery After Surgery. It's been shown to be successful in many different arenas of surgery, not just cardiac. We are one of the first institutions to really apply the principles of this sort of multimodal, multidisciplinary method and strategy for treating pain and discomfort, for getting folks mobilized early out of bed and working with different specialists from different disciplines to get folks comfortable and get folks recovered faster and home faster. Here in our program, we have the flexibility of allowing you to recover in the pediatric unit at Boston Children's versus in the adult unit at our neighboring and partnering institution, the Brigham and Women's Hospital, which is right next door. We determine whether either would be the best case scenario for you based on the balance between your anatomic and physiologic complexity related to your adult congenital heart disease on the one hand, and on the other hand, the complexity represented by adult comorbidities, other medical problems that you have that are unique most of the time to adults rather than to kids. And so, depending on that balance, we have the opportunity to go to either institution for both your surgery and your recovery. The one thing that would remain constant is the surgeon that operates on you. So just because you're getting surgery here versus there, one of us would still be the surgeon taking care of you primarily and seeing you through your recovery on a daily basis through hospital discharge.
Early after surgery, there's about a 6-week recovery period. And then in the long term, we like to make sure that the repair that was performed is accomplishing what it set out to do. So for instance, if you've had a valve surgery, we want to make sure the valves continue to work well and that your ventricle is pumping the way that it should. If everything heals according to plan, then hopefully you won't need any further surgery in the future, and you'll be able to get back to your normal activities. The goal of surgery for patients with adult congenital heart disease is to get back to a normal life, to allow patients to get back to doing what they enjoy doing. And even though it requires a surgical procedure, we think that within a couple of months, you're able to get back to your normal activities. And in many cases, if you're having symptoms, you'll find that relief of symptoms will allow you to be even more active than you were before surgery.